Hey babies, welcome back to my channel. Big love to the OGs, big love to the newbies. I'm just happy that you're here. So today I'm going to be going through my scar management routine. This is for very early stages, early days. I'm only 7 weeks post-op, so I'm going to be going through all of the products that I use, the technique that I use them with, and I just want to give a disclaimer before I start any of this. First of all, obviously, I am not a medical professional. Everything that I say here was basically suggested by my surgeon. I get a lot of advice from my mom as well. She is a qualified nurse who's been practicing for like over 30 years at this point. So I trust her. You don't have to trust her. That's a-okay. But yeah, so the surgeon recommended these products. He showed me how to use them. And yeah, I've kind of put my own little spin on things based on like my mom's advice, how I'm feeling within my body. So I recommend that you guys do the exact same. I'm really happy with how the healing journey has gone for me. Like everything looks so good. But different bodies are different. Different people are different. So yeah, just a little disclaimer to say that humans are different in every single way possible. Like you might not respond to one product well, you might not respond to one technique well. We all have different, trajectories of healing. It's very up and down. Anything can affect the healing process in our environment, in our diet, the technique the surgeon used, literally anything, okay? This is just what has worked for me. Like I said, I'm super happy with how everything has gone. So yeah, maybe this will help you plan out your routine, pick up products that you might vibe with. So yeah. So these are all of the products and little bits and pieces that I use as soon as I get out of the shower. I just keep it in one bag just so I can grab it and everything is here already. So I'm just gonna go through the bag, show you guys the products, and then later on I'll show you specifically how I use them, how I piece the routine together, and you can see more in depth like how I do things. We have a cup and also some cotton rounds, or a singular cotton round. This step is completely skippable, but basically, because I live in South Africa, no matter where you are in the country, there's been a lot of issues with water coming and going as it pleases. And when I first got the surgery, I was in Mpumalanga. And the town that I live has been so bad for water. Like, even the surrounding areas aren't as bad as where I am. And because of that, I just don't trust the water quality. Like, sometimes I open the tap and I don't feel like it's completely clean, or like, the way that I've been washing has been like very African style. I sit in a big bucket and like tip water over my head. So I don't feel like it's the cleanest way to be. So I have since moved to Joburg, and the municipality water here is really good. And where I'm staying, they have filtered water and they run it through like a UV filter as well. So I'm really confident with the cleanliness of the water. So basically what I use the cotton rounds for and the cup for is that I will boil the water. After I've had a bath, I will boil water just to get rid of like any scraggly bacteria that's hanging around. And then that's what I'll use to wipe down my nipple before I put any products on, rather than just leaving water that I don't feel is completely clean on like fresh wounds and then putting stuff on top of it. So yeah, first step, skippable step, but this is what we're working with. So next up we have Pibam or Superabam. I think this is like the branded version and this is like the generic market version, the Pibam. So basically all this is that it's like an antibacterial ointment that you use on like fresh scars, or like not open wounds, but like things that are still really fresh. And it helps fight like skin infections. So prevents skin infections, helps to fight skin infections. It just keeps the site like moisturized, but also there's that antimicrobial property to it. So yeah, keeping it clean, keeping it moisturized, and like, there's a little barrier over the healing part of your body that you're using this on. So I only use this on my areola and my nipple. So I first got prescribed the Superabam by the surgeon, and as you can see, I have rinsed this tube. Me being me, I'm gonna scrape the barrel until it's empty. I reckon I still have like a couple of days still left in this. I'm gonna use this at the bitter end. So yeah, once I finish this, I'm gonna switch over to the Pibam. I'll let you know the outcome. But this has lasted a really long time. Like I said, I'm 7 weeks post-op now, so this has almost lasted like 2 months basically. And it was not that expensive. Like in South Africa, you can get this over the counter, and I think it was like 130, 120 rands, which is, quick maths, I think it's around about £5, give or take. So yeah, not too bad. You can get this over the counter. Okay, next up, we're gonna move to the scar itself. And I have this tape. This is like, I don't know if it has a specific name, but this is like semi-permeable tape that you put over your scars as the stitches are still healing. So yeah, you just take the length and, you know, mark out how much you need, do a long strip of this, and yeah, I have scissors in the bag as well to help me out. So this is really, really good because it helps like give the scars extra support. So obviously in the early stages of your scars healing, you are still moving around a lot. The stitches haven't dissolved, like nothing has fully sealed in place properly. So this tape is really good to keep everything in place, to keep everything in position, and just create that barrier over the top of the scars. And the fact that it's semi-permeable, you can put like scar gel on top of it and it will absorb and, you know, still keep that protection. This is a really strong adhesive as well. Basically, the surgeon told me that you should only take it off when it starts naturally coming off itself, because you don't want to yank out of place any stitches that are still not like solidified. You don't want to cause any extra irritation. So yeah, this usually lasts about 8 days. Depending on how hot you have your showers, how well you press this down, how well positioned your scar is, all these things. But yeah, this is really great just to keep everything in place, and it helps you with like putting on products. Okay, next up we have Episim. So this is a fresh box and this is what it looks like with a little pump. So this is like a silicone based scar gel, and I just use this on the scars themselves on top of the tape. It absorbs really quickly, even faster so because of the tape. So yeah, nothing gets sticky, there's no weird residue, it's super lightweight, and it has like a lot of good properties in it that is more than just scar management. So the silicone in this makes it really good for like keloid and hypertrophic scarring. Those are kind of like the thick scars that are raised above the skin. So the silicone basically helps stop the scar from like adhering to the skin underneath, but also itself and like building on top of itself. So yeah, it's really good on helping like reduce the color and like the intensity of the scar. But also this is really good because it has like a lot of like antimicrobial properties to it. So as well as helping the actual healing of the scar, it keeps the tissue around it healthy and kind of just like helps your body naturally heal. Alongside the antimicrobial properties, it's also anti-inflammatory. So yeah, obviously your scars are going to be really irritated, they're still healing up, there's things rubbing up against them. So yeah, overall anti-inflammatory, antimicrobial, and also helps with the formation of like, well, helps prevent the formation of keloiding or hypertrophic scarring. So this is pretty spendy in my opinion for this like small tube. Okay, well this lasts, again, I'm 7 weeks. This has lasted me basically up until a couple of days ago. And it was about 600 rands, and you do need a prescription to get this in South Africa. So I think 600 rands, again, quick maths, I'm gonna say like 20-25 pounds for this. But my surgeon recommended this. He said that this is the best scar gel he believes is on the market. So I'm gonna believe him. I'm gonna keep using it. I use this twice a day. So when I hop out the shower in the morning and then in the evening, I kind of like, you know, do a quick wipe off of the scars, and then I'll use this again on top of the tape in the night. Okay, next up I have some hand gel, antibacterial hand gel, whatever. So basically I like to break up the routine into various parts, and I like to allow the products to absorb. So to give it time, I basically move on to other parts of my body, or like I kind of do other things. And sometimes I can't be bothered to completely refresh my hands by like washing it with bio scrub and like air drying it and doing this, like just doing the most with sanitation. Necessary, but also like sometimes not the most convenient. So hand gel. So next up I have some plasters. These are water shield, like, yeah, waterproof resistant, waterproof resistant plasters. And then I have some gauze as well. This gauze comes in like a big packet. and it comes in thin sheets like this. That's one, and usually I'll just fold it in half. So this is to cover the areola and the nipple after you've put on all of your products and you're about to put on a vest or a binder. It just keeps them protected from any external material irritation or like bacteria or anything, just a very loose barrier. You can also use like a little cotton round. For me, in the earlier stages, especially when like the nipple is still oozing a little bit, I just found like too much fluff was getting stuck everywhere, and I didn't want to like keep disturbing everything by like trying to scrub it off and like whatever. The texture of the gauze was a little bit rough for me. Basically it was causing a little bit of friction and like opening up the wound around my nipple. So I decided to switch over to the plasters. So when I went to see the surgeon about like, you know, just rechecking my wounds and stuff like that, he recommended to switch over to plasters. Basically my areola was healing well, but the nipple itself just needed a little bit more incognito mode, a little bit more sheltering, you know what I mean? So he recommended the plasters. The bag is empty. Those are all the products. I'm going to move on to the routine now. And I know you are all dying to see my crusty ass nips on YouTube, but it's just not happening today. So instead, I'm going to use a lemon. And I've marked out the areola in black, scientific diagrams, you know what I mean? So yeah, when I'm referring to the areola, that is like the bigger bit of the nipple and like the outside edge, what I've marked in black. And then when I say nipple, it literally means the very, very center, like the literal nipple. So yeah, so I've marked up the lemon. It looks disgusting. I'm very sorry. I wish I had more vibrant colors. But I've basically split up the areola into 3 and put the nipple itself as a separate section. So this is where the whole sanitation situation that my mom has been feeding me comes in. So basically the technique that I use, I try to keep everything separate to stop the spread of bacteria around the nipple itself. So we're going to be using like different fingers, different part of the cotton round, just to keep each section isolated. And yeah, so if there was an infection on this side of the nipple, but then you use like the same finger, same part of the pad, same whatever to clean this or to like put product onto this side, then the infection will spread and the bacteria will spread to this side. So it's just better to keep everything separate. So again, this part is completely skippable if you trust the water in your area, like I do now, but I didn't before, and this is why I have this step. So basically I put the boiled water in here, let it cool down obviously, or filtered water, whatever you're comfortable using. And yeah, I'm just going to clean off the nipple like, you know, after I've had a shower. So I get the cotton round, I've wetted the cotton round, not too much. And basically, again, we're going to keep everything as separate as possible. So to start out with, I'm going to use my pointing finger and I'm going to start on the very edge of the cotton round. And we're going to do our first color. So yeah, just keep it to the relevant third. So you see blue only. And then we shuffle around. And now I'm using my middle finger and I'm further along on the cotton round. And we're going to do our next section. Clean, clean, clean. And you can see that's only the brown. And then I'm going to move a little further along. Whoops. Further along the cotton round. Now I'm on my ring finger. And I'm going to do the very last section. And you can see that is the teal. So yeah, as you can see, these are a little bit close, but you know, as long as it's separate, it's okay. So you can see the teal, the brown, and also the dark blue. They're on completely separate sides of the cotton round, and I use different fingers. I move from this finger to this finger to this finger. And then now, for the nipple itself, I'm going to flip the cotton round and use my little finger to clean the nipple. So you can see on the middle, on the other side, it's just purple. And I'm using my little finger. So nipple is all clean, all the suspected dirty water is off. So yeah, I just let that dry down. Apply the Superior Balm or the Pib Balm whatever like antibacterial ointment that you're using. So we're gonna put a little bit on each finger. Don't use too much because obviously like you still want the area to like dry off and like the dead skin will come off. So to keep it like too moisturized can be a bit of a problem as well. But as long as there's like a good layer on there, you should be fine. So we're gonna use the same technique of like putting a little bit on my, what finger is it? Ring finger, and then we'll apply the piban, and then we use my middle finger to go around the bottom, and then my pointing finger to go around the other side, and then I use my middle finger to do the nipple. And then, yep, I just let that soak in and I'll move on to my scars. Okay, so you should have the tape on already. Like when you take off your dressings, your surgeon should do that. You can do that yourself as well. But yeah, this is with the assumption that the tape is on. So basically, I would wash my hands or put the antibacterial gel or give everything like a good wipe down so I don't have like residual bacteria, residual like ointment and stuff on my fingers. And I'll move on to the scars. So I will take the Epicin, and usually I do like opposite hands because it's easier to do this than to like try and do this. So yeah, I'll squirt it on. Okay, I forgot this is out, but don't put too much. Like you just need a small amount of this, like a thin layer. So this is why the tape is good as well, because it really helps with like portion control, so you're not using too much product, but it's still getting in there, you know. So you just put like a little bit, it would be like 1 squirt, and that should be enough to cover the whole thing, and very, very, very gently massage it in. So go directly on top of the scar, like just running it across, and then when you've hit everything, you can kind of go up and down and like around to spread it everywhere else. But yeah, I need to emphasize very gentle pressure. Like if you're doing this, it's your very early stages, like you still have stitches healing, you have internal stitches healing, you want the two sides to fuse together. So you don't want to be doing all of this, disrupting the situation. Like just be gentle. If something starts to hurt, you need to stop, you need to switch it up, you need to lighten your pressure, or just use one. I would just use 1 finger. Like I wouldn't even really do 2 unless I'm just spreading it around. But to kind of make sure that everything is in, I would just use 1 finger to press. So yeah, please be gentle with yourself. Don't use too much of this. And yeah, that's the scars done. Like it's super easy. So while all of the products are like soaking in, marinating, I'll move on to the rest of my body. Like I'll just moisturize everything while it's sinking in. And then I will wash my hands or use the hand gel, just make sure my hands are clean again. And then we're gonna cover the nipples. So, okay, so to cover the nipples, you can, like I said, I have gauze here. You can use gauze, you can use a cotton round, or you can use a plaster, whatever works best for you. Just be aware of like what products you're putting where and if it's gonna affect the stickiness of anything, if you know what I mean. Like if you use a plaster and you put like a thick silicone gel or like the pibam around your whole areola and then try to put a plaster down, it's not going to stick that well. But if you use something like Epicin or like a really thin silicone gel in the later stages when you stopped using the pibam and it's just fast absorbing, it leaves the skin dry, then you can use a plaster, like it's totally fine. But yeah, just for now, as you've gotten your dressings off, this is what I would recommend to do. So I have my gauze, I fold it in half. This size is fine for me personally. Technically you could fold it like this as long as it covers the nipple, like whatever. And then I take the tape, like the semi-permeable tape. I guess it doesn't matter, like you can just use any, okay, don't use any tape, but any like medical foot tissue kind of tape. So yeah, I pop this on the edges, and then I position it over the nipple, and then I just stick it on, just very loosely, leave it flapping into the wind like this. Yeah, you just want to allow a little bit of circulation and just as a barrier. Like it's not there to cover anything. It doesn't function as like a dressing. It's just there as a little barrier, and just to keep everything a little bit separate. Okay, so your nips are covered, you're all ready to go, you are basically done. So my surgeon recommended that I wear a binder belt, compression belt, for about 6 weeks post-op. Some people wear it for like a month. Like, I think just listen to your surgeon, what they have to say. They have the best advice and they know how you're going to recover the best. But under all circumstances, compression is such a good way to help with inflammation. It helps with circulation, and it's like that extra support that you need to keep everything together while the wounds are healing. So yeah, 100% get a vest, get a binder, and yeah, when everything is covered up, you can just whack it on. So the most common thing that people use are compression vests, or like binders that look like little vests, like literally like this, but it will be like an elastic material that's like really tight. So my surgeon recommended not to use those because like they can be too big, they can be too loose, like your body's constantly fluctuating and changing, and they don't have the best like adjustability. Like if something is too tight, you'd have to get like a whole other binder to deal with that, or if something is too loose, then you can't, it's just really awkward. So basically, I'm gonna really show myself here. Not too much, please guys, not too much. But basically I use this, it's like a waist belt. So I'm saying not too much because look how disgusting this is. But guys, like I was using this for like 6 weeks every single day. I was keeping it clean, you know, washing it and stuff like that. And like I just think like, because I was using the Velcro and I was like just tearing it off. You see how much force that it needs? So I feel like it just like completely deteriorated. But listen, it did its job. Like it stayed tight. I could adjust it however I needed to. It's like this thick neoprene material. So yeah, my surgeon recommended to use a belt like this with a Velcro, so you can like change how you're using it. It can be completely adjustable, and you don't have to be getting stuff that you're not going to use like, you know, in a few months time, in a few weeks time. So yeah, I would really recommend this. Like it served me well. I just took this off last week. It was very freeing. So yeah, the one thing though with vests and like whatever you're using to bind and to compress, that shit is gonna get so uncomfortable and sweaty. For me, this neoprene material just like, it was like collecting all the sweat and like sticking to my skin. It was like a weird vacuum. And it was just so irritating to my skin. Like it was the most uncomfortable thing ever. So that also happens with traditional binders, like vest binders. So I'd recommend putting like a tight vest, kind of like this, maybe not a rib material, but just like a cotton vest that is like form-fitting, or like a long sleeve t-shirt to keep warm, whatever. And then put the vest and the binder on top of that t-shirt. Your nipples are covered, they're not gonna, you know, come into contact with any like weird bacteria. So don't worry about putting a vest on underneath. It just, again, creates that barrier between the binder and the skin, and it just like helps so much with comfortability. I do feel like I'm gonna keep this just as like a memento, even though it's like destroyed and disgusting in every single way possible. It says something about my journey. It represents a stage in my journey. So I'm keeping this. We'll probably never use again, but would recommend that you guys get a belt like this that is neoprene and has Velcro, rather than a traditional belt, traditional vest. But yeah, up to your surgeon, up to you. Hey guys, so we've reached the end. That was my entire routine, step by step. If you have any questions, please let me know. And I just want to remind you guys to please listen to your body. Listen to your surgeon. They know best. You know best. No one can tell you what you're feeling. So you need to be able to like gauge what's happening. You need to vocalize, and you need to change when something is not working. If you're massaging too hard, it will start to hurt. Listen to your body. If you're compressed too tight and you can't fucking breathe, like change something. You know what I mean? You have to be comfortable. You have to be feeling safe. Okay, babies, so I'm sending lots of love. I will see you in my next YouTube video, and see you soon.